Medicaid School Based Services, also known as Medicaid SBS, are any physical and/or mental and behavioral health services provided to Medicaid-enrolled children in school settings or by school-based providers that are reimbursable by Medicaid. These services often include early and periodic screening, diagnostic, and treatment (EPSDT) services. EPSDT services are a type of Medicaid benefit that provides comprehensive and preventive healthcare services for Medicaid-enrolled children under the age of 21. EPSDT services are key to ensuring that children and adolescents receive appropriate preventive, dental, mental health, specialty, and rehabilitative services. Schools across the United States currently support access and delivery to physical and/or mental and behavioral health services in a variety of ways. Some examples include school nursing, school counseling and mental health services, occupational and physical therapy, speech-language pathology, sometimes called speech therapy, school-based health centers, which offer a full range of health services, dental services, vision and hearing screenings, audiological services, substance use prevention, screening, and treatment services, and clinics offering vaccinations, such as the flu vaccination. Schools can provide these services directly using their own employed providers and in partnership with other organizations, such as private healthcare providers, federally qualified community health centers, school-based health centers, public health systems, and hospitals. Why schools? Approximately 56 million children are enrolled in K-12 schools in the United States. Students spend an average of 6 hours a day in school, making it an incredible opportunity to deliver physical and/or mental and behavioral health services to those in need. This helps keep children in schools, especially those that may have limited access to health care. This also enables students with disabilities who need services in order to learn at school to receive them. School settings offer a way to improve health equity by reaching students with low household incomes. Delivering these health services to students in schools also reduces absenteeism, especially chronic absenteeism, reduces or eliminates the time and cost associated with transportation and scheduling health visits, reduces future health services needs by providing timely preventive care, and reduces stigma related to receiving services and support. Services at schools complement and do not replace services that students receive through their healthcare homes, usually pediatricians' offices or other community providers. Simply put, children who access physical and/or mental and behavioral health services in schools are less likely to be absent and more likely to graduate, be healthy, and earn higher wages as adults. Why is Medicaid important in providing school-based services? Medicaid plays a critical role in providing health services to children in schools. Approximately half of all children in the United States, or 38 million, are enrolled in Medicaid or the Children's Health Insurance Program, CHIP. Approximately 3 million of these children currently receive health services funded by Medicaid at school, and many more children may benefit from these services. With Medicaid coverage, schools can receive reimbursement for health services they already provide to students. Schools can seek reimbursement for delivering covered Medicaid and CHIP services and associated administrative and outreach activities. Medicaid SBS can be combined with other approaches to delivering physical and/or mental and behavioral health services in schools to ensure that the needs of all children are being met. Medicaid services provided to Medicaid-enrolled students in schools helps to reach more children, which may, in turn, reduce absenteeism, bring in additional providers to meet student needs, redirect dollars that would have gone to pay for services for Medicaid-enrolled students back to schools, and lessen the need to use general or special education dollars on health services and increase what is available for teachers. Medicaid SBS particularly matters to schools that serve children with disabilities, which is all schools. Under the Individuals with Disabilities in Education Act, IDEA, Children with disabilities are guaranteed access to a free and appropriate public education, FAPE, including all services outlined in a child's Individualized Education Program, IEP. Many students with disabilities require physical and/or mental and behavioral health services to make it possible for them to learn. Medicaid reimbursement for those services reduces special education costs and supports limited education budgets overall. While Congress appropriates funds to cover IDEA-related needs, federal IDEA funding only covers approximately 16% of the cost to educate children with disabilities, leaving the remaining costs, approximately $17 billion, to states and local governments. Medicaid funding can help fill the gap for some health services. Annual Medicaid reimbursement to physical and/or mental and behavioral health services reduces the $17 billion IDEA burden on states by approximately $4 billion. Medicaid reimburses schools for outreach and enrollment activities, as well as coordinating other services, like food assistance, that a student enrolled in Medicaid or CHIP might need. In other words, leveraging Medicaid funding helps schools help children succeed. So who are the key players and what are their roles in providing Medicaid SBS? Within a state, the State Medicaid Agency, SMA, State Educational Agency, SEA, and local educational agencies, LEAs, work collaboratively to provide Medicaid SBS for physical and/or mental and behavioral health services. Collaboration between SMAs, SEAs, and LEAs in a state is crucial in providing Medicaid SBS. SMAs should partner with SEAs and LEAs to determine the best ways to offer Medicaid SBS in their states, and may need to develop a state plan amendment, SPA, to ensure that SBS are compliant with CMS requirements for payment. SEAs serve as a liaison and advocate between SMAs and LEAs to align policy and program priorities for SBS. LEAs ensure that FAPE is available to all students, including those with IEPs or those who may be eligible for accommodations and services under Section 504 of the Americans with Disabilities Act. Some states may also have regional educational service agencies, which may participate in the delivery of Medicaid SBS. Once a state has determined what is right for their student population, schools, and Medicaid program, the SMA can collaborate with educational partners to set up or enhance the necessary SBS systems and services. States can cover Medicaid SBS delivered by a private provider participating in the Medicaid program. States that offer Medicaid SBS where school personnel directly deliver services or claim for administrative time must ensure that the SBS policies are consistent and compliant with all federal requirements. States must align with all federal SBS guidelines, which may require the approval of a SPA, Medicaid Administrative Claiming MAC plan, Time Study Implementation Plan, TSIP, or other materials by July 1, 2026. States should use Medicaid SBS resources for guidance on how to comply with federal requirements. These include the 2023 Comprehensive Guide to Medicaid School Based Services and Administrative Claiming, released by CMS, in addition to resources developed by the Medicaid SBS Technical Assistance Center, TAC. One example of a useful TAC resource is the Readiness Checklist tool, which was designed to help states draft an SBS state plan amendment, adopt certain flexibilities described in the Comprehensive Guide, assess whether the state plan reflects a compliant payment methodology, prepare additional documents such as a TSIP or interagency agreement for MAC, and discuss plans for SBS with CMS and across state agencies. For any questions regarding Medicaid SBS, please contact the Medicaid SBS TAC at schoolbasedservices@cms.hhs.gov.